Hello everyone and welcome to the NIOSH live chat, Public Health Inspections and PPE in the Time of COVID-19. My name is Laura Wildian and I'm the Senior Program Analyst in Food Safety for the National Environmental Health Association. It's my pleasure to facilitate today's webinar. I'm joined by my colleague, Reem Tariq, Project Coordinator for the Program and Partnership Development Department at NIOSH. Please note, this webinar is being recorded. If you are not okay with it being recorded, you may disconnect at this time. All participants will be in listen-only mode. Please submit any questions you have in the Q&A box, and we will do our best to answer as many questions as time permits. The COVID-19 pandemic has had a tremendous impact on the environmental health profession, and we thank you for your hard work and response efforts during these unprecedented times. NIOSH is dedicated to supporting the environmental health workforce, and we have provided several resources for our partners. This information will be made available to you after the completion of the webinar. Additionally, membership has its benefits. We create and deliver value for you every day. Connect with your peers, network, and get access to valuable resources and educational materials. If you are not already a member of NIOSH, check out our website at nihosh.org to learn more. I'm pleased to introduce our presenters today as we discuss inspections and personal protective equipment. First is Paige Dyjack. Paige is an infection prevention nurse at Washington Hospital in Fremont, California, where she leads the COVID-19 response. She has established a faculty-wide infection control care plan, including written standards, policies, and procedures for undiagnosed respiratory illness and COVID-19, including personal protective equipment education and training for healthcare. Next, we will hear from Dr. Kenny Fent. Dr. Fent has an MS and PhD in environmental sciences and engineering with a focus in occupational health. In his current role on the CDC COVID-19 response, Dr. Fent has developed guidance for first responders and other workers and provided technical assistance to the state health departments. And with that, I hand it off to you, Paige, to begin. Paige, the floor is yours.
Thank you, Laura. As Laura kindly introduced before, my name is Paige Dyjack, and I'm an infection prevention nurse at Washington Hospital. Today, I'm going to be speaking to you folks about personal protective in the healthcare setting. So I want you guys to keep that in mind, that this is primarily driven, and I'm explaining things that are mostly happening in my role day to day in the healthcare setting, but there's going to be some various tips and facts that are applicable to you folks in the environmental health setting. So first, I'd like to start off by describing the aspects that are basically what we do to protect healthcare workers from infectious disease. There's a hierarchy of controls. We're starting off with elimination and substitution. These are ideally the main source of hierarchy control, but although eliminating and substituting the hazard is the ultimate goal, it can be difficult and not always possible in the healthcare setting. So we look mostly at targeting our strategy in engineering controls within the hospital, administrative controls, and personal protective equipment, which I will be speaking in depth about later in this presentation. So things like environmental controls typically are airborne infection isolation rooms for patients with airborne disease such as TB or COVID, or for patients who are getting aerosol generating procedures. Administrative controls generally surround ways and procedures within the healthcare setting and early disease. And then last, it is very important for protecting the healthcare workers from disease. Next slide. So before we get into PPE, we need to understand the basis of transmission-based precautions. So standard precautions is a group of infection prevention practices that applies to all patients, regardless of suspected or confirmed infection status, to reduce transmission of infection among patients, families and visitors, and healthcare workers alike. All staff should assume that every patient is potentially infectious or colonize with an organism that can be transmitted to themselves or to others. The next type of transmission-based precaution is contact. So people who are in contact precautions, the transmission occurs when people touch someone or something in the environment that is contaminated with a potentially infectious material. Next, the next two are droplet and airborne, which are going to be the focus of our presentation today, as it surrounds most of the concerns related to COVID-19. Any pathogen that is transmitted via droplet transmission, occurs via talking, sneezing, coughing, or any heavy droplets that are sprayed into the air and fall within a 6-foot radius. Airborne precautions are microorganisms or viruses that are transmitted via very small particles that drift on air currents, such as droplet nuclei or dust particles. These small particles can remain suspended in the air for long periods of time and have the potential to travel long distances. So, when does a droplet have potential for airborne concern? This picture here kind of shows and describes the nature of how droplets are transmitted and how aerosolization of droplets can potentially happen. So, we're primarily concerned about heavy droplets having the potential to become aerosolized, generally when any of our patients are receiving aerosol generating procedures. Some of those aerosol generating procedures would include intubation, nebulizing treatments, someone who's on BiPAP or CPAP, that's forcing air into the respiratory tract that might have a forcible expiration of those droplets that might break them up into tiny droplet nuclei. On a regular everyday basis, droplets generally are heavy and they fall and land within a 6-foot radius. So all of the personal protective equipment listed here help to prevent healthcare workers from being in contact with infectious agents such as body fluids or any other agent that has the potential to cause an infection. You can see examples of PPE here include gloves, goggles, face shields, face masks, and respiratory protection. And in the next slides, I'm going to go into each one specifically and the service that they serve in the healthcare setting. Just a little bit of background into why we wear PPE. PPE actually originated back when the bubonic plague was prevalent. This picture here that you can see is an example of what was called a plague doctor. So before we actually even really knew specifically about maybe how disease transmission, protect yourself and to wear some sort of a barrier between you and the patient or the pathogen. So typically gowns were made of a very heavy fabric or leather and were usually waxed. The beak that you can see here in the picture normally contains some sort of a pungent substance or herbs that was used, sometimes perfume, that they thought would potentially be purifying the air. Gloves at the time were typically also made of leather, and glasses were used to protect their eyes for any potential droplets that they were foreseeing that could infect them. Luckily today, in modern science and modern medicine, we don't walk around wearing this leather outfit anymore, and it's a little more modern looking. Some of the considerations that we need to take into mind when we're talking about certain types of PPE, it all depends and it's based upon the hazard of the worker. So any expected or potential encounter with any infectious material will then drive the type of PPE, and how it's transmitted will drive the type of PPE that we expect the healthcare worker to wear. We want to make sure that PPE is always properly fitted, and if it's something like a respirator, we want to make sure it's constantly refitted. We want to make sure it's consistently and properly worn. PPE is there to help protect our healthcare workers, but if it's not worn properly, if it's not put on safely or removed safely, then it's hindering the whole purpose of having that PPE to begin with. We want to make sure that that PPE is in good, intact condition. So we want to make sure it's regularly inspected, maintained. Any respirators or things that can be replaced, we were making sure that they're all, there's no expired material and everything's up to date and working properly. And then lastly, we want to make sure that that PPE is properly removed, cleaned, and stored appropriately to make sure that it is safe and not contaminating yourself when you're putting on the PPE. Okay, so first item of PPE that I'm going to be discussing is gloves. So gloves are to protect the healthcare worker against any infectious material. However, once those gloves become contaminated, they can become a means for spreading infectious material to yourself, patients, or other people in the environment. So this is something that I really try to drive into my folks at the healthcare facility, that yes, gloves are great, but you really need to be aware that they can become a potential source of touch contamination. And so touch contamination is when that glove then becomes a fomite, or a mechanism by which bacteria can, or any pathogen can adhere to and be spread around within the environment. So they do serve a purpose and they are important, but typically gloves outside of any immediate anticipation, because we want to remind healthcare workers that you hand hygiene and wash your hands on a regular basis, that gloves do not take the place of proper hand hygiene. Next, we're going to look at isolation gowns. Isolation gowns, there's various different types available out there. And they're designed to help protect the wearer against any physical contamination with infectious pathogens. It can protect your personal body or the clothes or scrubs that you have on underneath. There's various types of material, and they can come as either reusable or disposable. Currently within the hospital right now, we're looking at transitioning into a more sustainable method. So we're looking away from that disposable method of gown and into the reusable gown that are laundered each time after use, and that they're going to be inspected to ensure that they're safe and adequate form of protection for our staff. And then with gowns, we want to look at whether or not they're branded as being fluid resistant or impermeable. So when we're looking at gowns that are fluid resistant, this usually refers to a type of fabric that resists fluid penetration, but up to a certain point of tension on the fabric, there is a possibility for fluid to seep into it. So it's fluid resistant, whereas impermeable means not allowing passage of fluids at all. It's impervious to any type of microorganism or fluid that might land on the gown, and that can refer to blood, water, viruses, any of those items. Next, we're going to take a look at eye protection. So there's various types of eye protection available out there. We have goggles, face shields, and then full face respirators. So goggles provide barrier protection for eyes, and they really are the best type of protection available for mucous membranes, specifically the eyes. When you look at goggles, we want to make sure that they are indirectly vented. So some goggles that are out there that you'll see will have some specific openings on the sides, because we do recognize that they can have the potential to fog up or a little bit difficult to see through. So we want to make sure they're indirectly vented, meaning if we see that potentially there's any droplet that can enter into the goggle, that it's not going to come directly into the eye, that there's some sort of a mechanism there that allows air out but no potential pathogen in. Face shields are also a great option because they can protect the entire face and all mucous membranes. And then if you have an N95 or a surgical mask underneath, they're really great to help protect and maintain the integrity of the mask underneath. Unfortunately, safety glasses and prescription glasses do not form that full protection up against the face. They're not tight fitting, so there is the potential for droplets to enter through the safety glasses or prescription glasses. And then of course we have full face respirators, which I'll be getting into later, are intrinsically designed to offer that eye protection embedded within the equipment. Surgical masks. So masks should fully cover the nose and mouth and prevent fluid penetration. Masks should fit snugly over the mouth, and for this reason, we like to see that surgical face masks have that bendable nose piece over the top to ensure that it's fitting adequately and safely to your face. They can either come with elastic ear ties or they can come with head ties. And I just want to reiterate that surgical masks and face masks alike provide protection against large droplets, splashes, and sprays. So we're thinking about things that are primarily transmitted through droplet precautions. Also, when we look at surgical masks and face masks, these are primarily a source of source control. So you're looking at containing the pathogen within the mask, and that's what we really look at the aim of surgical masks or face masks. So here are some common do's and don'ts of face masks for healthcare personnel. This is also applicable to most people out in the environmental healthcare setting or just in the general public. We want to make sure that that face mask, if you're wearing a cloth face mask, any of those types of things, are on properly. We don't want it underneath the nose, halfway hanging out, underneath your chin. You have to remember that that you're breathing in, all of those pathogens are going to be landing up at the front of that face mask. So you want to be cognizant of how you're storing that face mask and how you're carrying it. When you're taking it on and off, always remove it from the ear loops. Never want to touch the front of that face mask as you're moving it up and down off of your face. And as a general reminder, every time you touch any face mask or surgical mask, you should perform hand hygiene before and after. Before, because you're coming up to your mucous membranes, you want to make sure your hands are clean, you don't want to contaminate. And then after, if you're reusing a mask, whether it be a cloth mask or things like that, if you're in the general public, that potential front of the mask may be contaminated. So after you've put it on, you want to perform hand hygiene to make sure you're not transmitting any other pathogens via contact transmission. Alrighty, so this is the types of respirators that we generally look at in the healthcare setting. We have disposable N95s, which I'm sure most of your folks are recognize and see most of the time. There's half and full face P100 respirators, and then we have either controlled or powered air purifying respirators. You can see the pictures here along the right-hand side. So the intention of respirators are to protect employees from exposure to respiratory hazards that are transmitted via aerosol. So we're thinking about airborne transmission here, droplet nuclei. In our healthcare setting, it's required for healthcare workers who are working within 6 feet of patients to be known or suspect for COVID-19, or any patient that's undergoing any aerosol generating procedure to wear one of these types of respirators. NIOSH has approved 3 classes of particulate respirators for air purifying respiration. We have here N, R, and P. Just quickly, N is for non-oil particulates. So if you have an N in front of the respirator, it means it's protecting you against all the particles except for oil. If an oil-based particle were to land on the respirator, that means it has the potential to saturate through. R is for oil and non-oil particles, but there is a maximum of an 8-hour service time. And P is for oil and non-oil particles, and there's no time restriction. And then there's various classifications of efficiency of filtration. So 99, 95, 99, and 100%. So what we normally typically see with the N95, we have that 95% filtration. And then there's various different types of respirators out there that will offer the 99% and 100%. Just what I would like to reiterate, and what I always tell my staff all the time, is that all 3 of these are NIOSH approved forms of respiratory protection, whether it's 95% all the way to 100%. When you're using a respirator, you want to make sure that to ensure that you have full adequate protection, that that each employee is fit tested. So there's two methods of fit testing. We either have a quantitative method, which you see up here on the right. There is a machine that actually measures the amount of particles that is in underneath the type of respirator that you're using and outside of the respirator. This method leaves zero room for error. It is a definitive quantitative number to tell you whether or not you do have that good seal for that respirator. And then there's also here at the bottom right-hand side, you'll see a picture of the qualitative method for fit testing. Qualitative methods, they normally spray in some type of either a sweet or a sour solution into that hood that you'll see, and you'll know if you have a good fit if the healthcare worker or the provider underneath can't smell that solution. And there's various different activities and passages that they have to read that will simulate a work environment to see if that does have a good fit and nothing is seeping in. With respirators, we want to make sure that everyone is fit tested prior to the initial use and annually thereafter. And then if there's any major changes to the employee's physical shape, so if someone has gained weight or lost weight, that could potentially affect the shape of your face and the fit of your respirator. For respirator reuse and extended use. So reuse, there's a distinction between these two. Reuse is using the same respirator for multiple encounters with the patient, but removing it after each encounter. So you go in and out of a room and then you're removing that respirator and maybe putting it back on when you're going into another room. Extended use refers to wearing the same N95 respirator for repeated close contact encounters with several patients in a row without doffing or removing that respirator. Here in the hospital, we do reinforce and recommend that we have our healthcare providers do extended use of the respirators. That's because it reduces the overall, you have overall less touching of that respirator. It's on your face for a longer period of time. So that therefore will be inherently less risk of contamination when you're putting on and off that respirator. When we have respirators, we want to talk about, if you're reusing them, what your storage looks like. So as I mentioned in the beginning, we want to make sure those respirators are stored in a breathable, covered location, either within a brown bag or something along those lines, to make sure that there's no potential contaminants getting in on that respirator that you're going to be putting up towards your mucous membranes. Here is just a picture here that describes putting on and off respirators. So we just like to remind folks that you don't want to be crossing any of the straps. You want to really avoid touching that front of the respirator without any masks if you can help it. And then when you take off your respirator, make sure you're always handling it by those straps and that you're doing hand hygiene after.
Apologies, folks. I think we might have lost Laura because she's having some technical issues. I will share my screen page and pick up where you left off.
Okay.
Okay. All right. And all right, you're good to go.
Okay. So we can go to the next slide. So this here, I just wanted to have this side by side here about the difference between surgical mask and N95 respirators, because these are the main types of respiratory protection that we're seeing out there for COVID-19. As I'd like to reiterate, surgical masks provide barriers against respiratory droplets. And as of today, the predominant mode of transmission for COVID-19 is still droplet, not airborne. We're only worried about potential airborne aerosolization of COVID-19 if some of these patients are receiving aerosol generating procedures, if they're having that forced volume into their lungs that might potentially create that droplet nuclei. So anything outside of those aerosol generating procedures, that source control and that mode of barrier against droplet protections is provided either through that surgical mask or our general face masks that we're seeing out there. And then for N95s, we really want to save those for high risk procedures such as aerosol generating procedures or any surgery that is involving potentially high risk for COVID due to the anatomical regions such as nose, mouth, throat, oropharynx, or respiratory tract. This here is kind of an overall just picture of the type of PPE that we see our healthcare workers wearing in the when they're taking care of COVID-19 suspected or confirmed patients. You can see over here on the left-hand side, we have the N95 respirator or higher. We have the gown, the face shield, and the gloves. And then on the right-hand side, we see, which is also acceptable, there's a face mask. N95 respirator or higher is preferred, but face masks are an alternative option. Go to the next slide. And then just overall important reminders for PPE. I like to remind my staff that this is a slow and methodical process. It's not a race. You don't want to go and just rip off all your PPE because that's what's protecting you. You want to make sure that that is not going to be the thing that is infecting you at the end of the day. You want to remove it and discard it carefully, and then always perform hand hygiene before and after. Here, we're going to be talking about, just to close up, to try and make this a little more applicable for your folks out in the environmental health sector. There's various risks as defined by OSHA for occupational risk related to COVID-19. We have very high all the way to low risk. Very high and high are going to be those folks who are going to be working within a 6-foot radius of those COVID-19 patients or suspected patients, and then they're receiving those aerosol generating procedures, those types of things. For you guys out there doing your inspections, those type of things, you're going to be classified in the lower and medium risk. So if we can go to the next slide. Low and medium risk job exposures, really what we want to drive home is that we want to pay attention to those preventative actions. We want to make sure that when you're out there, that you're social distancing at least 6 feet, you're implementing that either your facial mask or that cloth face covering to protect against any droplet or respiratory droplets, and that you're washing your hands and you're cleaning and disinfecting any frequently touched surfaces. And that's the main driving factor that you guys are going to want to be looking at outside of the healthcare setting.
Great, thank you so very much, Paige, and my sincere apologies. The lightning flashed and the thunder was here, and then I lost power and internet. So I have switched to an alternate internet source. Thank you very much, Reem, for picking up, and I hope it was seamless. So now I will pass it over to Dr. Fent. Dr. Fent, the floor is yours. Thanks so much.
Thanks, Laura. I'm also having some thunderstorms here, so hopefully I don't lose power as well. But I'm Kenny Fent. I'm a research industrial hygienist at NIOSH. I've been with NIOSH for 12 years, and the majority of my career has focused on exposure assessment research on firefighters and other first responders. But currently I'm a part of the CDC COVID-19 response. And I've provided a lot of guidance to first responders and public safety workers and other occupational groups. But I actually began my career at NIOSH in the Health Hazard Evaluation Program at NIOSH, and that program shares some similarities with what public health inspectors do. We can go really to any workplace in the country to do an evaluation of workplace hazards. And so I really have drawn on that experience in developing this presentation. And then also CDC is currently working on developing I guess, guidance for public health inspectors, which is still in development, but we hope within the next few weeks that will be posted. So I guess the first thing the first question we need to ask when we talk about COVID-19 is how is it spread? And I'm sure that a lot of the folks on this call probably already have a really good understanding of this, but you know, it is spread primarily by person-to-person contact when people are in close proximity for an extended duration. And just as Paige had mentioned, mainly through droplet transmission when you cough, sneeze, or talk. That said, there is the chance that you could also become infected when you touch a surface or object with the virus on it, and then you touch your mouth, nose, or eyes. But that is not thought to be the main way that the virus is spread. And then the last thing is that there is some evidence, that people who are infected with the virus, SARS-CoV-2, but are not symptomatic may be able to spread the virus. And that's actually one of the properties of this disease that makes it so difficult to control. So how could a public health inspector come in contact with the virus? You know, obviously, you know, anytime you have close contact with other people, that puts you at an increased risk. And certainly that's possible when you're doing your inspections in the field, but also when you're, you know, working in your office space, if you're not teleworking and you're around other coworkers or around the general public. There's also the potential that you can touch, you know, potentially contaminated surfaces and then touch your eyes, mouth, or nose. And then I think most importantly, there is the chance that public health inspectors are going to have to go into facilities where COVID-19 transmission is occurring. And that includes healthcare facilities like nursing homes. So, so how can you protect yourself as a public health inspector? And there's a number of tools that we have in our tool belt that really, I mean, apply beyond just workers. It applies to the general public as well. But for workers in particular, one very critical tool is to not work when you're sick. So if you're sick, notify your supervisor and stay home. And then also, if you're well, but you live with somebody or you've been around somebody who has been diagnosed with COVID-19, again, notify your employer. Your employer may want to implement flexible sick leave policies or telework options in those circumstances. And then your employer may also want to consider daily in-person or virtual health checks. And we do have some guidance on employer screening, CDC interim guidance for business and employers. And it's one of the resources that's listed in front of you now. Another important tool, which Paige also mentioned, is social distancing or physical distancing. So we want to try to keep 6 feet or more distance from others. And so with respect to inspections, try to conduct some elements of the inspection virtually if that's possible. And I'm getting a note that people can't hear me. Some people can't hear me. Okay, I'm going to continue, but please let me know if you can't hear me. So if there is that option to conduct some elements of the inspection virtually, you know, that's a great option. So for example, interviews, document reviews, or even opening and closing meetings. Within your office building or laboratories where you work, you can also use tape or other markings to denote 6-foot distancing. So for example, in offices or conference rooms or break rooms. And then when you do conduct inspections, if possible, try to go during off-peak times where there are fewer people present within that facility. But that really must be balanced with the purpose of the inspection. So if you're wanting to look at processes, then that may not be possible because you need to make sure that the facility is at full capacity. Another tool in our tool belt is, of course, cloth face coverings, which I don't want to belabor this too much because Paige did a great job talking about it. But we do recommend wearing cloth face coverings at work, in the field, and in the public. And just as Paige said, cloth face coverings are really designed to protect other people, not the wearer. However, there is some protection afforded to the wearer, and it is important, even with cloth face coverings, to make sure that they are being worn properly and completely cover the nose and mouth. When you do inspections, also encourage cloth face covering use at the facilities being inspected, and you can consult state and local regulations to help support their use in those facilities. Fogless eyewear is also important. We've heard a number of times from people who have prescription eyeglasses that they do tend to fog up when you wear face coverings, so it may be important to try to procure those fogless eyeglasses if possible. Even with cloth face coverings, it's important to continue to cover your coughs and sneezes when you use tissues, to make sure they're thrown in the trash. And then, just as Paige mentioned, conduct hand hygiene before and after using cloth face coverings. With respect to hand hygiene, that's a critical tool in our tool belt. It's important to do that regularly with soap and water for at least 20 seconds. And if you don't have access to soap and water, then you can use alcohol-based hand sanitizer containing at least 60% alcohol. And it's important to wash hands before, during, and after preparing food, before eating food, after using the toilet, after blowing your nose, coughing, or sneezing, after putting on, touching, or removing your face coverings, before and after work and work breaks, and then also after touching frequently touched surfaces such as door handles, pens, cameras, cell phones, keyboards, and so on. Another tool that we have is to clean and disinfect surfaces that could be contaminated during the workday. And so when you're in the field, you don't have a maintenance staff that's doing that for you. So one option is for your employer to provide sanitizing wipes that can be used so that when you leave the facility, you can clean some of those items like clipboards and pens, cameras, electronic tablets, and those kinds of things. It's important that any cleaners that are used are on the EPA list of approved disinfectants, which I think a lot of folks on the call are familiar with. And make sure that the cleaners are safe for electronics if they're going to be used on electronics. Make sure to follow the directions on the product's label. And then also just try to minimize the number of items you bring into a facility being inspected. So one element that I think is somewhat unique for public health inspectors is that your job requires travel. And so there are existing CDC recommendations for travel that include ways to reduce your risk when traveling. And some options I just want to mention is that it's wise to try to avoid public transportation when possible. And so it may be better to drive a government vehicle rather than flying if the travel distance makes that possible. Also wearing face coverings when you are not when you're necessarily when you're driving unless you have an employee with you, but when you stop for gas or food or use the restroom. And then just conducting cleaning and sanitizing of frequently touched surfaces when you do take public transportation or rent vehicles or stay in hotels is also a good precaution to take. And then obviously, hand hygiene again. You'll hear that a lot. So if you do have to inspect a healthcare facility, it's important to determine what precautions and controls are in place at that facility, and then consult with your supervisor to determine if additional controls are needed. We would recommend that you consult the infection control guidance for healthcare professionals, which is one of the resources listed here. And it is possible that you may have to wear PPE in those facilities, especially if you do have any contact with COVID or could have contact with COVID positive individuals. However, and Paige mentioned this, the preference is to maintain physical distancing and avoid close contact with those individuals during inspections. So a lot of what I've talked about is what can a public health inspector do to protect themselves, but there's a number of things that your employer should also be doing. It's important that your employer is developing a COVID-19 workplace health and safety plan. There are a number of resources that CDC has for employers, and one of those is the CDC Interim Guidance for Businesses and Employers listed on the screen. And this plan should be developed with input from employees. So we often recommend a health and safety committee that includes labor and management. It's important to identify a COVID-19 coordinator who's most familiar with COVID-19 transmission and precautions. Your employer will want to implement flexible sick leave policies and incorporate telework options, especially for people who are at higher risk for severe illness. Consider daily employee screening or health checks, physical distancing measures, access to soap, water, paper towels, and hand sanitizer, cleaning and disinfection of frequently touched surfaces, and then also training and signage. Lastly, CDC is currently working on some contact tracing guidelines for employers, so that's something else that your employer will want to stay on top of. So some other considerations for your employer for field work is that they really do need to consider off-site field work in the health and safety plan. They need to be familiar with what state and local regulations apply to the facilities being inspected, and collect information about COVID-19 precautions at the facilities being inspected, even if that means pre-announcing the inspection. And then importantly, train and equip inspectors with to be able to comply with infection control protocols that are in place at the facilities, provided they're as protective as your organization's protocols. And then make sure that employees know what to do if they become sick when on travel. And there are CDC recommended steps for self-isolation and when to seek care, as well as return to work guidelines. So Paige mentioned the hierarchy of controls, which often go in tandem with a hazard or risk assessment. The hierarchy of controls lists the effectiveness of controls from most effective to least effective, and engineering controls are near the top of that pyramid. Engineering controls are intended to isolate people from the hazard, and some options for your employer are to redesign workstations to maximize physical distancing, make sure workers face away from each other, and incorporate physical partitions where possible. Your employer also can make sure that the workspace is well ventilated and maximizing outdoor air while maintaining temperature and humidity for comfort, and increasing the filter efficiency of the HVAC units to the highest functional level. Some other options are to install touch-free faucets, towel dispensers, hand sanitizer dispensers, foot-operated doors, and water bottle refill stations. And then also, it's important to make sure that personal fans are not blowing towards other workers or occupied spaces, because that can actually spread. If somebody were to sneeze, it could spread the virus to other people. Administrative controls are intended to change the way people work. Some options for your employer are to conduct training so that workers know how the disease spreads and the symptoms and preventive measures. I actually think training is one of the most important controls, because you've got to get buy-in across your workforce. It's important to use signage and infographics that can be understood regardless of someone's first language. You can maintain small groups of workers and teams. That helps also to minimize the spread of the virus, and if you do have to do any contact tracing if someone were to become sick. It's important to clean and disinfect those frequently touched surfaces, to make sure restrooms are well stocked, to implement policies that minimize travel or face-to-face interactions for inspectors. So that, again, is looking at virtual options or technological support to conduct certain elements of the inspections virtually. Equip inspectors with sanitizing disposable wipes for use in the field, and then require face coverings, especially when when your workers are in close contact with other people. Personal protective equipment is at the bottom of the hierarchy of controls. It's considered the least effective, and that's mainly because it relies heavily on the user. But that being said, PPE may be required by the facility being inspected or by the employer. If PPE is required, it's important that the workers are trained on the proper use of PPE. And for N95 respirators in particular, it's important that that inspectors would be medically cleared and fit tested, including clean shaven, and as part of a respirator protection program. So I know Laura provided I think on your screen you can see the different resources and links to existing CDC guidance. So please do review those links for more information. And then please be on the lookout for specific CDC guidance for public health inspectors, which hopefully we'll post within the next few weeks. And I'll turn it back over to Laura.
Great, thank you very much, Dr. Fent. Pleased to say that we do have some time for questions. So we've received quite a few, so we'll get through as many as we can. The first question is, let's see. How does the effectiveness of generic fabric masks commonly used by the public compare to surgical masks?
So the intention, surgical, or I should say face masks, have various levels 1 through 3. Surgical masks typically are a level 3, are intended for surgery specifically because there's the anticipation of any large droplet potentially landing near the face. Also, it's source control so that you're not breathing heavily into a sterile field when there's surgery. Levels 1, 2, and 3 are all approved by CDC for elements of source control and respiratory droplet control for COVID-19. And cloth face masks offer this same type of protection. We're just talking about surgical masks specifically because that relates more to the healthcare setting specifically, but all of the levels of the face masks and that cloth mask do offer that barrier to prevent any of those droplets leaving the mucous membrane, such as the nose and the mouth.
Thank you. The next question is what PPE is recommended for environmental health investigators going into food facilities that are conducting case and contact investigations. The EH investigator will go into a retail, food, manufacturing, or wholesale facility where there are COVID positive employees. So what PPE is recommended for these investigators?
Yeah, that's a great question. So a lot of it also depends on the onset of community transition within the area of where you're doing that inspection. It would be advised that you speak to the facility beforehand to get specific nature of the work and what proximity are you going to be in relation to someone who's going to be COVID positive. Generally, if you're just walking through the facility, you're not going to be within a 6-foot radius if anyone's suspected or confirmed for COVID. You're doing that hand hygiene. You really just need that mucous membrane protection, primarily your nose and mouth with either a cloth face covering or a face mask or a surgical mask. Anything additional to that, you would need to specifically understand the nature of the risk associated with the work that you're going to be doing. But mostly just try to focus on those preventative measures to keep yourself safe.
Great, thank you. We've received a lot of questions about ventilation in buildings, and I'd like to read one specifically. There has been much discussion about wearing facial coverings, 6-foot separation distance, and hand washing, but very little discussion on the use of ventilation in buildings to control COVID-19. Could you discuss the effectiveness of ventilation to control COVID-19 in buildings?
I can try. We do have ventilation experts here at NIOSH who would certainly be better equipped to answer that question, but we have been providing quite a lot of guidance on ventilation, especially to different businesses and factories, and it does help. I don't know if we have the scientific publications yet to point to, but just in terms of dilution ventilation, so the more airflow, especially outdoor air, that you can introduce into a space, it does help just with ventilation or with diluting any particular droplets or aerosols that are produced from individuals. And then there are local exhaust ventilation options as well, depending on the process. So we've looked at portable HEPA filter units, for example, upper, I forget what it's called, ultraviolet radiation in the ceiling. So depending on the operations, there are some other options that will have some effectiveness. That said, it's still important to practice, social distancing and source control.
Thank you very much. We are receiving several questions about the effectiveness of an N95 mask versus a cloth mask, specifically when conducting an inspection. As we all know, sometimes we can go into food establishments or hygiene establishments and it's tight spaces, lots of employees. Some jurisdictions are requesting that there be minimal employees present. Can you talk a little bit about the difference between a cloth mask and an N95 mask, and if an N95 mask is recommended for employees that are conducting inspections?
So, and I think Paige gave a pretty good response on this already. I don't think N95s are going to be required unless you're going to get within, close proximity to individuals who are, known COVID positive cases. Your first, tool is to maintain that social distancing from those individuals. Now, obviously, we can't say for certain. I mean, even when you're in the general public, you may encounter somebody who's COVID positive and they're not even symptomatic. But the face covering, the general precautions related to physical distancing, I think are going to be our primary tool. But if you do have to get within 6 feet of somebody who's suspected or known to be COVID positive. And if that workplace is requiring N95 respirators, then that might be something that you need to do as well.
Thank you. Let's shift gears a little bit here and see if we can answer this question. What is considered an acceptable barrier between adjacent cubicles and adjacent booths at restaurants? So adjacent cubicles at work and adjacent booths at restaurants.
Laura, can you explain that question a little bit more?
Certainly. So when we're in office setting, you had mentioned separating employees, not having them face one another. Is there a certain acceptable barrier that you might see between cubicles? And is there a certain acceptable barrier that you might see between booths of people that are dining inside food establishments?
Well, I think there's different options, and I've seen different ways of approaching this. Plexiglass, for example, even shower curtain kind of materials. I think any of those options, as long as they are impermeable kinds of materials, I think will be effective, because again, it's mainly to create a barrier against droplets. And then it's also important that you're covering that area where there could be droplet transmission. So you don't want a partition, like let's say you're at a workstation and it includes a standing workstation. You want to make sure that that partition would go all the way to head height if you were standing, not just when you're sitting. And so that's an important consideration. Also, when you're dining, just make sure that it's the right distance from the floor to whatever height people are going to be sitting at.
Certainly, thank you. I've received several questions about glasses fogging up with masks. You can imagine if we're working in environments where you're having to do inspections, that it can make work difficult. Is there any recommendation for that? And a piggyback to that question, is a face shield and goggles also recommended with a mask to further protect against virus transmission?
So I can speak from some of the things that I've learned in the healthcare setting. It is unfortunate that a lot of times when you're wearing one of those face masks, that sometimes it does have potential for the personal glasses to fog up. The best thing that we've seen to work is if you really position that face covering, whether it be cloth or a regular face mask, up higher on the bridge of the nose, and then the glasses to come up underneath or over them, it does prevent a little bit of that fogging. Unfortunately, it's kind of just the nature of what's to be expected when you're wearing a face covering, that there is going to be a little bit of fogging of that. But if you kind of wear up the mask, as long as you're fully covered underneath the chin and up higher up on the bridge of the nose, it does help a little bit with the fogging. And then can you repeat that second part of the question?
Certainly. One of the questions that came in around the face shields is how transmissible is COVID-19 through the eyes and the mucous membranes via droplets, and thus how important are face shields?
So when you're thinking about eye protection, if everyone around you in the vicinity has their mask on, whether it be a cloth mask or any type of face mask, that's that source control that we're really concerned about. So if you've got that source control, there really is no risk for any droplets to be transmitted and reach to the mucous membrane, such as the eyes. So what we really want to reiterate is that eye protection is really needed when you have potential to come in contact with a patient or any person within the community that is suspected or confirmed for COVID, and they're not being compliant with their face mask. That's the greatest risk associated, and those are the times that we really want to reiterate using that eye protection.
Thank you. And we have just a few seconds left. I wanted to get to one last question for you. Is there any evidence or reports of environmental health inspectors contracting COVID-19 during their inspectional work? I saved the best question for last.
I don't know. I'm not aware of any reports, but I also don't know that we have, looked at that analysis in depth. So maybe I could get back to you on that.
That would be great. Thank you, Dr. Fent. Okay, we are at the top of our hour. I would like to thank Paige Dyjack and Dr. Kenny Fent for sharing their experience and expertise with us on this webinar today. Thank you to all the attendees for your time and participation, and thank you for bearing with us through our stormy weather. This concludes our webinar today. Stay well, and thank you.